At the top tonight, definitely not a great time for the winter break to come to an end for school districts as coronavirus numbers continue to climb.
Also seeing an uptick the number of pediatric hospitalizations across the state. Here at home, Driscoll Children's Hospital currently treating 5 children in the hospital battling the virus. Now, none of those patients, though, are currently in the ICU for COVID.
However, the hospital tells us tonight that they do have 14 children in the ICU battling other viruses, including RSV and pneumonia. According to officials with Driscoll Children's Hospital, that leaves 8 pediatric ICU beds available. Michael Gibson takes a look at how the rise in hospitalizations is putting pressure on hospital resources.
On Monday, we had some 960 people go through the county's testing site at Memorial Hospital. What's the situation going on with children? Are we seeing that same level of concern for them or that same level of outbreak from apparently the Omicron?
I will say that so far, Michael, I am seeing obviously some pressure on our emergency department and testing with Omicron, but we're certainly not seeing the degree of illness that we saw with that Delta variant in the August-September timeframe.
Dr. Mary Peterson is Executive Vice President and COO of the Driscoll Health System. She says the number of COVID cases among children has been on the rise lately, but it's nothing compared to what was going on with kids and COVID back at the start of the school year.
In the last week, we've had 278 children test positive with COVID in our community. And so that is high, but it's not nearly as high as what we experienced with the Delta surge.
Right now, the hospital only has 5 children hospitalized with COVID, and none are in the ICU.
I would say that we're seeing a lot of viral illnesses in children right now, and COVID is one of several.
The director of our public health district is worried that we could soon see an even bigger increase in the number of children catching COVID.
I think in the United States, we're seeing that there's been a 50% increase in pediatric cases. And so we're expecting to see something very similar. We usually follow suit.
Dr. Mary Peterson says the wait time in the ER is a little bit longer than they would like to see, and that's due to parents bringing in their children to get tested for COVID. She's asking those parents to try and have their children tested elsewhere so that they can treat those kids who are actually sick and in need of real emergency care. Michael Gibson, 3 News.